Hello, welcome to our session on investing in health in emerging markets. A very important topic. I think we don't need to debate, I think, the evidence in relation to investments in health and the positive impact it has on lives, on well-being, and on the economy. There's lots of evidence already in relation to that, and there's growing evidence, of course, from many, many sources. But we believe health is a human right. It in itself has an intrinsic value. But ultimately, the question is, how do we get sufficient investment into health systems, particularly in emerging markets such as Africa? And if we can do that, the potential, of course, is huge. At the moment, that funding comes from a mix of sources, from donors, from the private sector, and of course from in-country funding as well. And the question is the balance of that funding right, and can we find ways to increase funding for health across Africa? So this session will discuss how African leaders, their international development partners, and the private sector can come together to maximize the return on investment in health systems and deliver better health and economic outcomes for the region, because undoubtedly better health does lead to better wealth, to increased wealth. Okay, so I'm delighted to have with me today Lady Rosalind Marotta, the Vice Chair of the Board of the Global Fund. Welcome. And also Lieutenant Colonel Dr. Tharcisse Mapunga, who's the Minister of State in charge of primary health care in Rwanda. Welcome to the session as well. We will be taking questions, so I'd urge you to, and I want this session to be as interactive as possible, so I'd urge you to be ready with your questions. We'll have a microphone that you'll be able to, a roving mic you'll be able to speak to. So we'd like to take those questions. We also take questions from our online viewers and audience as well, so do send your questions in to us. So, first of all, turning to Dr. Mapunga, where do you see the biggest opportunities for investment in health in Africa, in Rwanda in particular, which is, of course, where you're a minister, in the next 5 years, and how has this changed from where we were a decade ago?
So, thank you very much for inviting me to this important discussion. And also, I'm glad to be part of this conversation around the investment in health. So, Africa is the continent with a growing population, closer about 1.4 billion now. And it is a continent that requires huge investment to be able to address equitable health care. So the Agenda 2063 that has been adopted by the AU member states in 2015, transforming Africa into a global powerhouse of the future, set ambitious goals that can inspire the ambition of Africa to be a prosperous, based economy and inclusive and sustainable development. So one of the key goals is to ensure that the citizens are healthy and well-nourished, and adequately a level of investment are made to expand the quality of health care we need. So, guided by that strategy, the AU is working to ensure the development are putting in place relevant structural institution to support the knowledge building, management emergencies, and disease outbreak to enhance medical product production, as well as capacity building and human resource. So the Africa CDC have been established actually to support the health ministries and the health system to be able to detect, prevent, and also to control emergencies like what we are dealing with this time. So this is one of the opportunities we think can attract people to come and invest in how we can build a resilient system in the Africa continent. Again, the African Medicine Agency, Rwanda have been selected to host the agency, the headquarters of agency. So soon we are now working on putting in place all requirements to have these agencies starting working by December. So it is also, again, it's coming, the AMA, the African Medicine Agency is coming, again, as a tool to support countries and the region to improve the regulation so that the African people can have safe and affordable medication. So I believe those policies and the strategies and undergoing effort are a huge example of the investment people can make in terms of Africa continent. So,
thank you very much, Dr. Mapunga. Can I ask you specifically about Rwanda, though? Where do you're talking about the African Union, Africa-wide policies. What are the particular opportunities in Rwanda that are different from 10 years ago? What's changed?
Yes, of course, Rwanda also is a country which is developing as Africa countries. So we are striving to become upper middle income country by 2035, and also to be a high income country by 2050. So this is very ambitious, but feasible.
But presumably you believe improving the health of the population is intrinsic to that?
Yes, of course.
Yeah.
So based on that vision, so we have been setting up a national strategy for transformation and the health strategic plan. We've guided very ambitious target, but achievable, to be able to address the growing need of the population in 5 years. So, of course, we are building on the existing resources, our home growth solutions in the past events.
Okay, good, thank you. We're delighted also to be joined by Dr. Omari. Thank you for joining us. And I forgot to introduce myself. I'm Cameron Abbasi, Editor-in-Chief of the BMJ. My next question is to Lady Rosalind Marotta from the Global Fund. The Global Fund's work in fighting AIDS, tuberculosis, and malaria is one of the most well-known success stories in Africa. I think we can say that. With an estimated return of $31 in health gains for every $1 invested. But not say pound, the value of the pound is unreliable at the moment, in health programs. Yet the COVID-19 pandemic has not only put pressure on all health systems around the globe, but also on funding for global health aid. Now, obviously that's something you've been very busy in over the last week or so. How can we ensure that we don't lose momentum in terms of this funding?
Thank you, Dr. Abbasi, and thank you very much to the WISH organizers for organizing this session. The Global Fund is a very unique organization. It's a partnership. It's not really a donor. We're a partnership of governments, both donor governments and implementer country governments, of the private sector, of technical partners, and also very importantly of civil society. Academia, churches, representatives of churches, of faith-based organizations, and most importantly, people living with the diseases, HIV, TB, and malaria. Over the last 20 years, we've invested over $55 billion in over 100 countries. And the results of that $55 billion are 50 million lives saved, and the combined death rate from the three diseases has been reduced by over 50%, which I think is a remarkable achievement. The way our funding works, the allocation is based on a combination of the disease burden in a country, and also the ability of the country to pay for its own health programs. So on that basis, over 70% of our money does go to Africa. And 28% to the rest of the of low and middle income countries which qualify. So $55 billion over 20 years, but last week, in fact, the US hosted a replenishment conference for the Global Fund to cover funding for the next 3 years. And we successfully raised the highest amount ever for a global, in global health, $14.25 billion so far, with a number of countries yet to pledge, either caught up in elections or other reasons why they couldn't pledge at the pledging conference. And we do appreciate Qatar's pledge of $50 million US. So this was an unprecedented mobilization of resources for global health. And quite frankly, with all the competing demands at the moment, problems, geopolitical problems, war, climate change, I think it was a very good result. We were very pleased that we lost no donors, and donors felt that this was a really important cause that they must continue to contribute to. The US itself put $6 billion on the table for the 3 years, and that was a 30% increase over their last pledge. And many other G7 countries followed suit. Canada increased by 30% to 1.21 billion Canadian dollars. The European Commission pledged 715 million euros, also a 30% increase. Germany pledged 1.3 billion euros, a 30% increase. And Japan also went up 30% to 1.08 billion US dollars. France, not quite so high, but significantly increased their pledge to nearly 1.6 billion euros. Some partners actually increased by more than 30%. And one of the most notable was the Republic of Korea, which showed remarkable commitment by quadrupling their pledge from $25 million to $100 million. Private sector too increased. We raised $1.23 billion from private donors, and this is a new record of private sector money to the Global Fund. Last time around it was 1 billion, almost 1 billion, and this time 1.23 billion, with a 20% increase from the Bill and Melinda Gates Foundation and RED's pledge of over $150 million. As I mentioned, the UK and Italy are still to pledge, and we're going to continue to mobilize resources over the coming weeks and months. Our target was actually $18 billion, and we still want to reach that. Our estimate is that with that $18 billion, we can save 20 million more lives just in the 3-year period, and we'll reduce the death rate from the 3 diseases by 60%, over 60%. So we need the $18 billion, and we will continue to raise that. But one important point I want to make is that we have implementing countries also giving money to the Global Fund as well as receiving it. It was really remarkable that at the pledging conference, all the African presidents, for example, who spoke, really stressed the importance of increased domestic resource mobilization, increased expenditure on health by their own governments. So 20 implementing countries actually made a pledge in New York a week ago, 18 of which were from Africa, which I think is terrific. It shows their confidence in the work of the Global Fund and wanting to contribute to it as well as to receive money.
Okay, I mean, I think that's a very interesting change. I presume from your last round of replenishment that's changed dramatically. Can I just ask you quickly about COVID? I mean, what impact has COVID had on countries' willingness to fund you?
Obviously, it didn't prevent the big donors from funding. But by the same token, we have to remember that $18 billion, it sounds like an awful amount of money, but it's just a drop in the ocean compared with the money that the rich world spent on itself, on their own COVID responses. But COVID put us back a long way in our fight against the three diseases. For the first time in the 20 years of the Global Fund's existence, we had some reversals in progress, directly as a result of COVID. And we responded very quickly to COVID, mobilized over $4 billion, additional to the $14 billion we had raised at Lyon in 2019, to deploy, to help countries respond to COVID, not for vaccines, but for the non-vaccine response to COVID, treatment, diagnostics, PPE, and so on.
Okay, thank you. We'll perhaps talk a little bit more about this later. Dr. Omari, can I come to you next, please? What do you see as the main value proposition for investing in health in the region? So by investing in health, what are the benefits that can be gained more broadly for society?
Okay, thank you very much. I think there's no alternative to health, because this is one of the biggest capital of them all. So what we have seen, especially in African continent, we have a huge number of youth, of which we think that investing on their health and well-being will be very important for the development of the continent. Just thinking of taking Tanzania as an example, we have almost 50% of our population is youth below 18 years of age. But it is very unfortunately, there's a huge number of under 5 mortality, which we think if we don't invest on health, we could lose a huge part of our young generation, which actually needed very much for development of the countries and the continent in general. So to us, there's an alternative to invest than investing in health.
Okay. Can I ask you to begin with then? I've got some questions for the panel, and I hope there'll be questions from the audience very soon. I mean, we've talked a little bit about private money and how that also helps and invests in health. But is there a risk of increasing inequalities by inviting private sector healthcare solutions rather than focusing on expanding publicly provided care? What would be your view on that, Dr. Omari? I think it's working.
Yeah. Actually, to me, this is my personal view. When you look at Africa as a place that I know, it's different from the rest of the world. In Africa, we have a generation which lives like other nations when you are in your 50s. And we have areas where the generation lives like they are in their 70s. And then we have a population which lives like the 21st century's generation, like the rest of the world. So one size fits all in Africa is a little bit different. Their region, for example, I'm coming from Dar es Salaam, whereby 80% of services are from the private sectors and not from the public sectors. So there are areas where private facilities can do better than public because of the increasing demand on high-tech services. And there are areas which need just basic services, especially those in the rural and remote area, where public investment is highly needed because we improve access to service. Because those people in those areas, most of the times, they just need a basic service which are provided by a government. But in most of the urban areas and people of high elites, most of the times they need advanced services which the government sometimes may fail to offer. And then you need the private sectors to invest.
But shouldn't governments be offering more of those services? I mean, I suppose the question is, what's the balance? Is the balance right between private and public funding?
It is, and at the moment we are increasing, because in almost a decade ago, almost 60% of the investment on health were from the donor and philanthropies. But at the moment, it is almost, there's a shift, almost 60% of the investment on health is coming from the government funding, and only 40%, around 35% from donor community, and 15 is out of the pocket contribution from the local population.
Okay.
So
Thank
there's
you.
a fair improvement on our funding.
Thank you. Lady Rosalind, what's your view on this?
It's inescapable that private medicine will have a role to play. And I think it varies from country to country how much support the private sector should get from government. I live in Papua New Guinea, and in fact, over 50% of the health system is run by church agencies, not for-profit agencies, but by church agencies. And they deliver very efficient, in fact, probably in many remote areas, a much better service than the government could provide. My view is that the government needs to subsidize this to support it, because it's an efficient use of public funds. Rather than trying to compete with the sector, it should support it. But I mean, there are obviously questions about how much government money should go to for-profit medicine.
Okay. Dr. Mapunga. What's the balance between public and private? Is there a risk that with investment from the private sector healthcare solutions, they increase inequality? And what we really want to expand publicly provided care.
So I think there's no risk, but there's an advantage. Because
okay.
the government alone cannot fill the gap we have. They cannot be able to fix the issues we have in the population. So we need a partnership, a very supportive partnership for private sector. So, but the government also has a key role to play in that, to put in place a conducive environment, creating these funding opportunities, and also making these trying to put in place strategy in the guideline, which is helping the investors to come and support the government. So I see that government alone cannot be able to fix the problem. So private sector also should not be seen as a profit organization who is coming to make money. I think can also be able to fix the issues. So for now, we are talking about religious, faithful religious who are taking the lead in remote area, fixing the issues. Of course, private, there's about the business inside. So most of the time, they are focusing in the area where the people they have, there are many people that are able to afford and to afford and to pay the service they are providing. But that's our role as a government, also to try to make some incentives. How can we balance what the government is putting in place and how private sector can support in that, I say.
Okay, thank you. We're going to take some questions from the audience. Are there? Oh, yes, we have questions. Okay, take one from the front, then one from the middle. So let's start here. Yeah.
Thank you very much. It's good to be here. And I just want to, not really a question, but rather just to give also my comments on the question that whether investing on the public is a risk or whatever. And their first question was the advantage of investing on health. I think investing on health is very important, and this is something that we need to make sure that it happens, because if you invest on health, especially on the improving the outcomes, then you have more people who are going to work and then to generate more funds that will contribute into the development than the people who will be going into the hospitals, so they don't have much time to work. But secondly, when you are asking a question about whether it is a risk for the public, I think it's not. In fact, it complements the work of the government for the public services. The only thing that we have to make sure that it reduces the inequality is to put the guideline and the standard very clearly how they operate these private. If you put that right away, I think it will complement, and then there'll be no any inequality. Thank you.
Okay, so the government's role is regulating satisfactorily
Exactly.
the private sector.
Exactly.
Thank you very much. We had a question in the middle and then one at the front. There's one at the middle first, sorry. Yeah.
Thank you very much. I'm very much intrigued by the remarkable development and progress that Rwanda has made over the last 10, 15 years. What I want to understand is what are the ingredients of this success, and can other countries, not only in Africa and elsewhere, learn from? Thank you.
Thank you. That's clearly for you, Dr. Mapunga. What are the ingredients of your success?
So I want to answer the question very simple.
Yeah, that's good.
So there is the leadership commitment. That's one. The second, Rwanda is a country which have been hit by the genocide, 1994. So now everything has been destroyed. So we are now struggling to rebuild our country. So all people that are motivated, they are so coming together. Now how can we come up with this disaster? The last, Rwanda is a country of innovations who's attracting a partnership. So putting all together, that's one of the key success of our countries.
Yeah.
Maybe there's others may see if at that time we can discuss more about that.
Thank you. Thank you. Lady Rosalind.
I'd just like to add on to that, those 3 points that the Minister made as an external observer of Rwanda and many other countries. Obviously, one of the keys to the success in Rwanda is the very low level of corruption, efficient use of public resources, unlike many of the countries from which we come.
Okay. Thank you. Then we've got a question here and a question. We've got 2 more questions, then one online. So if you'd keep your questions brief, we'll try and keep the answers brief and we'll get through everybody. So the gentleman on the 3rd row. You need a microphone. Yeah.
Thank you very much. This is more of a question from a private investor who would like to invest in Africa. Of course, the ease of doing business in Africa is getting better, but I think there is room to improve. Some countries better than the others, but in general, for a private investor who's seeking to redesign and develop the healthcare economy in Africa, what are the kind of incentives that you would have to provide? I think you touched upon it, Minister, but I'd like to really understand if there's a forum for people, for investors, foreign developers, hospital operators who could come into the country and really elevate the standards of healthcare, because unless until you don't have strong PPP regulatory environments, I think it remains a challenge that will continue to remain.
Okay, thank you. So a quick answer on incentives for private organizations. Dr. Amari.
I think one is market. You'll be able to have a market which is not saturated yet. Again, most of the it's a need from the population, because especially on health sectors, there's a huge demand on health services and especially health technology. We are buying it. We are not producing in our areas. And then we have a strong PPP policy. And for example, in Tanzania, we have a tax-free period that's to allow investors to have a good environment to study the market at the moment. Sometimes take up to 5 years having a reduced or subsidized tax when you want to invest in the country. Again, Tanzania is within the SADC and East African region, which cover almost 13 countries that you can trade with without any problems. So these are some of the incentives when we talk to investment in Tanzania.
Thank you. Dr. Mapunga, would you like to add any comments to that?
Yeah, so few comments. I think
Yeah.
every country have a a particular way how they operate. So from Rwanda perspective, we have an institution who's in charge of attracting investors dedicated for that, Rwanda Development Board. It is the role of this board is now to ensure that they attract the investors, they are showing where the area of investment, and also they are reducing all the administrative processes, which is making people not be able to come in Africa because they are those back and forth, they are not getting. So for us to register in a company in Rwanda, it will take for 24 hours maximum. So one day you came, then you register, you have everything. So that's one of the investment thing. And second, there's willing the government also to partner with the investors.
Okay.
Giving grant, reducing taxes, all those things were making people not being happy. If you bring materials from outside the country, come in the country, taxes are free. So there's many kind of investment where we are trying to put in place to attract investors. So for example, now you see, Rwanda is now championing putting in place a robust system of the pharmaceutical manufacturing, for example, with BioNTech and others. So all those that are coming in the country because of this environment which is attracting them, they're giving the security for their investors. So maybe we can share with them that they have a very big document which talking about this.
You can talk afterwards.
Yes, I can talk about
Okay. Thank you very much. We've got a question, one more from the floor. I'm going to actually take an online question before I come to you, if that's okay. And this is for you, which is why I haven't asked you about investment. So the online question is, a letter to the Global Fund signed by several organizations has recommended the inclusion of investments in NCDs associated with HIV, TB, and malaria. Has the Global Fund any plans to include NCDs?
This is a very hot topic, often discussed by the board. I don't say we don't have active plans, but some of the grants do actually cover diseases related to HIV, TB, malaria. So, not an active plan at this point, but I would say that it's not impossible in the future.
Okay, I'm going to take one quick question.
So, well, I know that there are not any simple answers in anything to do with health, but I'm missing a couple of points from the discussion in terms of the enthusiasm for the private sector to meet certain demands. One is, my understanding is that about 98%, we heard from the last session, of financing in health is going to treatment and not to prevention. And I don't see the private sector, but perhaps I'm missing something, and particularly the for-profit sector, as meeting the needs for prevention. And if we want a healthy population, we clearly need to invest there. So that's one. And just pertinent to the whole COVID sort of happening, one of the things that was underscored in LMICs was that, vaccination systems, and this is just illustrative of a health system deficit, for vaccination is geared all around pediatrics, but not for adults. And in terms of being able to deliver vaccines for adults, you need a system for tracing and bringing them in and so forth. And that just highlighted the fact that we don't really have anything for adolescents. We don't really have a system for NCD screenings or, systematic investments, which the likes of the Global Fund, are not geared to do. So I do see that in terms of realizing ambitions for health, there's some very sort of stark, glaring, persistent old needs that still need solutions. And I haven't heard these being discussed. Thank you.
Okay, thank you. I think the first one particularly, Dr. Mupunga, can I ask you, which is, as Minister for Primary Healthcare, are you seeing funding from the private sector in prevention? Because clearly that is something that's required.
Yeah, actually, I can invite him to come to my country.
Okay.
Why? Because
she says yes.
I give you an invitation, please.
Yeah.
Because the private sector is now leading the primary health care services. So they are owning almost 45% of the health center, district hospitals. So they are not being at big town Kigali like that. They are going to the community. They are hiring health posts, health centers, and the clinics across the country. 45% they are totally under private sector. So meaning they are not treating only, they are preventing. And they are part of this process. The private sector have played a key role during the COVID pandemic. Even detection, they are supporting staffs, they are giving resources. They're even now participating in vaccination. So Rwanda is one of the countries who has a big vaccination coverage. It's not because of the government, but the government, it's because of this partnership with the private sector.
Okay.
So today we are now vaccinating 5 to 12 to 11 children. This is one of the, I think we're the second country in Africa where making these deals. Because of there's a good partnership, and this is typically seen in our country.
Okay, thank you. I'm just going to broaden that question out finally for Dr. Amari and for Lady Rosalind. How do we get more investment into prevention and primary healthcare? Dr. Amari. 30 seconds.
Okay, one, just to invest on education and the awareness campaign, because most of the investment in preventions needs willingness of the people, because they need to understand why they do so. If you create awareness, you make people understand the disease phenomenology, most of the times they'll be able to invest in prevention, especially in primary health care, rather than investing financially. In our health sector strategic plan, we have almost 30% of our budget goes to prevention, but in most cases we need people to understand. So investing in education, that would be the best investment on primary prevention.
Okay, thank you. Lady Rosalind, finally, I mean, clearly we don't want emerging countries to repeat the mistakes of richer countries by investing in treatments, in secondary care at the expense of primary care.
At the expense of, no. Obviously, Global Fund programs do fund a number of prevention programs in all three diseases, but whether the balance is correct, I would argue not. We need to spend far more on prevention than we currently do. Take HIV, for example. In Africa, the huge incidence among young women and adolescent girls, who clearly we have to target prevention programs very specifically toward that population. But at the same time, treatment is prevention. For HIV, if you successfully treat someone, they're not going to, and you can have viral suppression, then they won't pass it on to other people too. The same with TB. You actually have to treat people to prevent the spread of TB again. So it's not just treatment or prevention in some cases. I don't know whether the 98%, 2% data stat is correct. I expect it is.
I'm sure you'll get a reference if you want to.
Yes,
yeah.
But I mean that's horrifying if it's true. 2% only on prevention is crazy.
Okay, I'm going to have to wrap it up there, but I think there are clearly many issues to disentangle. I think what we can be clear about is that investing in health is the right thing to do. The question is, how do we increase that investment in health? What's the mix between private money, between donors, between money spent by governments, and where that money is spent is also very important. So I think there are lots of issues to unravel, but I think we can all agree that investing in health is very important. So thank you for joining us for this session. I'd like to thank Dr. Mapunga, Lady Rosalind, and Dr. Amari for joining us. Thank you all very much.